there, my name is Sarah. I'm a naturopathic doctor in Toronto, Ontario. It's Saturday today. It's the weekend. And I thought, let's keep things fun. Let's keep things casual and make a reaction video. A few days ago, I found this video here. It's called Relaxing Naturopath Visit, ASMR Doctor RP. It's gotten 6.8 million views, so it's pretty popular. So I thought that it'd be fun to watch it with you, get the full ASMR tingly experience, and also touch on whether the video accurately depicts what goes on in an appointment with a naturopathic doctor like myself. I hope you enjoy this video, and if you do, please go ahead and acupressure the like button or the subscribe button, or you can leave a comment down below. Okay, let's begin. Okay, so here's the channel that we'll be watching, Gentle Whispering ASMR. And now I'm just gonna type in Naturopath to find her video. And this is the video that we'll be watching, the Relaxing Naturopath Visit. Again, I said 6.8 million views, so it's very popular. It was uploaded 2 years ago, so let's have a look.
Hello, sweetheart. Welcome to my naturopathic practice. Nice to meet you.
Nice to meet you.
So as you know, we here mostly rely on natural remedies and massages, on herbal supplements. Basically give you an option for an alternative medicine approaches. But of course, we never exclude other types of medicines too.
Okay, so right off the bat, I gotta say that I can already see why this ASMR video and ASMR channel is so popular. I really like her presence and her energy. Her voice is silky smooth, perfect for ASMR, and her eyes are bright and attentive. They're slightly intimidating to look at. It seems like she's staring right into my soul, but in a warm and welcoming kind of way. I like her summary in the beginning because a lot of people do not know what naturopathic doctors do. She covered the herbal remedies, the supplements, and massage, but we also do acupuncture therapy, cupping therapy, a lot of diet and lifestyle recommendations. We do more than what she has said in her summary.
Today, just to give you a heads up, I'm going to look at your body as a whole, try to look at your concerns and issues, and then examine you part by part, so I can make...
Okay, so that was a little weird to hear, examine you part by part. In naturopathic medical school, we kind of learn how to say things so that they don't sound too awkward and weird. Saying part by part isn't the most pleasing way of saying that you'll be doing physical exams. What I usually say is, in this appointment, I'm going to ask you a lot of questions about your health, and then I'm going to do a few relevant physical exams to further understand the state of your health. Something along those lines. I wouldn't say stuff like, I'll examine you part by part. It's just a little weird.
A proper diagnosis at the end and let you go well treated and with prescription. Okay? Good. Your main concern is persistent headache. Now, would you say it lasted for over a week? For a few days? Okay. Were you in any type of accidents lately? Any injuries?
I hope not.
No? Okay, that's good. How's your stress level? Do you go to school, maybe exams or work? Yeah. You know, stress is one of the biggest forces in our life. It can break down so many things, and our body works as a unit. Everything is intertwined, everything is connected. So when one thing falls apart, it just goes down from there. So we're going to pinpoint the actual problem and issue, and we'll deal with that to make sure that we prevent as well as treat your pain. Okay? All right. So if you don't mind, I'm going to come closer to you. Like,
Now I know for her video, she's not trying to do a full naturopathic intake. She wants to keep it brief so that she can get to the nice ASMR sounding stuff, I bet, I'm assuming. And, but for the purpose of this video, I do want to get more in depth in what I would do in my naturopathic appointments to really assess and understand where the headache is coming from. She's already covered two things like trauma and stress, which are two very common causes of headaches. But whenever someone new comes into an appointment with me, whether it's for a headache or cough or fatigue, I always want to be sure that the thing that they are concerned about isn't due to something really serious or emergent. I want to do my best to rule out any red flags that I see. So, for example, with a headache, I'd ask questions like, what's the intensity of your pain? Is it very high or more moderate and mild pain? I would ask about the location of the headache, or do you have any other symptoms like change in vision, hearing, sensation, in your ability to move? I'd ask those kind of questions to help me rule out more serious causes of the headache. For example, the headache could be due to a stroke, it could be due to a hemorrhage, it could be due to cancer, it could be due to a serious infection called meningitis. So those are very serious conditions that if I see any signs or symptoms of those diagnoses, then I'd have to send them to the emergency room. They can't stay in the office with me. They need to go to the ER right away and get emergency treatment there. So I'd be sure to rule those out. But if they didn't have any of those serious signs and symptoms, then I'd talk about other causes of headache like dehydration. Maybe it's a side effect of their medications. It could be due to a thyroid condition. I want to rule out those things as well before jumping to the conclusion that it could just be stress.
and if I may, place my hands on you.
Okay.
So today, I'm going to concentrate mostly on your upper body, your shoulders, your neck, your face, and your head. Right? I will also take a closer look into your eyes and at your tongue. I'll tell you about that later. But first, if I may, I'll just go over your hair. I'm just looking at the volume and the structure of your follicles. Paying attention if there's any breakage or discoloration.
So it looks like she's going through the hair to check the health of the hair, which is great. I personally look at the health of the hair, the volume of the hair, if there's any patchy spots of hair on the head. I also look on the scalp to see if there's any bruises, scratches, random marks, or any swelling as well. She's doing a very thorough assessment.
So you can just relax. You can already feel that it's going to be quite a pleasant experience, isn't it? When someone plays with your hair or examines you up close, it's so relaxing.
I think that if I played my hair like that in an appointment, my patients would think I was really strange. But I know for this ASMR video, it's nice to hear the hair being played with. Imagine if a practitioner was petting your head like this, that would be a little awkward as well.
And we'll shine this little light in there too.
So it looks like she's checking out the ears, which is a great exam to do because sometimes an ear infection can get so bad that it can cause a headache.
I'm basically trying to eliminate all possible causes, so that we can pinpoint exactly what causes everything. Okay?
Sounds good.
So I'll look at your ears and your hair. I'll need to take a look at your skin. I think I'm going to put on my gloves for that, okay? So 1 second.
Okay.
You like some of my herbs? Yes, a lot of times I hang them around and dry them, and then create different types of supplements, serums, or drops, oils. Interesting, huh? Okay.
So first off, I want to say whenever we are about to touch a patient, we try to wash our hands or use sanitizer or put on gloves. In her case, she did put on gloves. The thing is, after you've cleaned your hands or put on the gloves, you want to keep your hands and gloves clean. So for her to go and touch her dried herbs and her shelf and her plant kind of defeats the purpose of putting on clean gloves. You want to keep them as clean as possible before you go touch someone's face. Another thing that I want to comment on is that she mentioned that she prepares her own supplements and herbs and salves and tinctures and stuff like that. And in reality, most naturopathic doctors do not prepare their own herbal preparations. They usually, and myself included, we usually just have our patient go buy something from the store that we recommend, something that is already pre-made. We do that because of standardization. It's important to know how much of a herbal constituent the patient is taking in, and when it is made by a company that actually measures out how much of something is in a capsule or in a certain volume of a tincture, that helps me as a practitioner know exactly how much is going into each patient. When you prepare your own herbal tinctures or herbal capsules, you don't know exactly how much of an herbal constituent is being given to the patient. So the treatment isn't very standardized. You don't know if the person is getting really high dose or a low dose. So that's why most naturopathic doctors will not prepare their own stuff. But there are some really old school naturopathic doctors out there who do prepare their remedies and tinctures for their patient. It's really cool and it's awesome to know how to do it. But it would be better to just send them out to take already pre-made stuff because of the standardization.
I'll be just absorbing your skin textures. Okay, let's just... Is this okay? I'll start with forehead. Now, right now, I'm going to be pressing a little bit along your nose here and the sinuses area. Oftentimes, headaches are caused by sinus inflammations, yeah. So, let me just, how does this feel here? Here.
So it looks like she is palpating the sinuses, which is great because headaches can be caused by sinus infection and congestion. Sinuses are hollow cavities in the bones of our face. So there's a maxillary sinus right here. There's a sinus right here called the ethmoid sinus, and up here there's the frontal sinus. So they're all empty spaces in the bone of our face, and sometimes bacteria and other irritants can get caught in those spaces and cause a little bit of inflammation. It could be infected, and if that occurs, then a lot of pain, tenderness can occur, a lot of congestion can happen. So what she's doing here is palpating these areas to see if they're tender or warm to touch, to assess to see if it is if the headache is from sinus infection or congestion.
Okay, I'm going to press my hands on your neck right here, just a little bit harder than usual, because I'm going to be trying to palpate your lymph nodes. Okay, here. I'm not trying to harm you, I promise.
Oh, that's good.
But you let me know if something is tender or
So it looks like she is checking out the lymph nodes, which is wonderful because if the lymph nodes are tender with palpation, if they are warm to touch, or if they feel swollen, then that could indicate that the person is having an infection, and that infection may be the cause of their headache. We have a lot of lymph nodes down the side of our neck, also at the back of our neck, at the base of the skull. There are some lymph nodes behind the ear, in front of the ear, and also right underneath the jawbone here. So in a regular appointment, if I was suspecting infection, those all would be palpated to just see if there's any swelling or tenderness in those lymph nodes. So that's wonderful that she's doing that.
This muscle could also cause a lot of headaches all the time. It gets strained very easily just by sleeping the wrong way. So I'll look just real quick on the back of your neck here. How's this feel here?
So I'm assuming right now she is palpating the muscles of the neck and shoulders, which can be very, very tight if a person is stressed out, or if they sleep incorrectly, or if they are doing a job that requires them to be in an uncomfortable position, like being at a desk all day or doing a lot of overhead movements. These neck and shoulder muscles can be tight, specifically the SCM, which are the long muscles going from behind the ear down to the collarbone. The scalenes on the side of the neck can be really, really tight and can cause some referral pain, so headaches as well. There's upper trap muscles here that can be really tight and sore. There's the levator scap muscle that can be really, really tense as well. Assessing the tension and the tenderness of all these muscles are really important to see if it's due to those muscles that the headache is arising.
Okay, so how do you feel so far?
Great. I mean, terrible.
Now I'm going to examine your eyes, your beautiful eyes. Yes. I'm going to flash some light. Flash some light. Use a flashlight. So if you could, for me, follow the flashlight. Each note. Okay? So just keep following it. It's not too bright. No? Doing great. If you ever look at that, to my nose. Keep looking.
Staring at her nose.
Keep looking.
Still looking at your nose.
And let's close one eye. Good. Good. Now think to the other side. You're keeping my nose still. Okay. Well, that looks good.
Okay, so a few comments on the eye exam. One, I'm really glad that she's doing the eye exam. It is something that I would assess as well if someone was presenting with an acute headache. And it's important to check the eyes and other senses of the body because the thing that could be causing the headache could also have an impact on the cranial nerves of the body. And so the cranial nerves to the eyes could be affected, so you want to be sure that vision is intact. So the test that she did, well, the two tests that she did was the pupillary light reaction and the consensual light reaction. So the first one was the pupillary, and I can't say it well, the pupillary light reflex test, and that checks to see if your eyes are responsive to light. So what she was doing there was exposing each eye to a little bit of light, and what you would want to look for is to see the pupil go from dilated to constricted, because when the eyes are exposed to light, they want to constrict to limit the amount of light that enters the eye. And when you're in a dark room or outside in the darkness, your pupils will dilate to try to get as much light in as possible so that you can see as best as possible. So she was doing that, which is great. She was shining the light in front of each eye and checking to see if the pupils constrict. Now, her second test, the consensual light reflex test, was a little bit off. She was covering one eye and then shining the light again. So essentially, she was doing the same exam twice. In order to do the consensual light reflex properly, you'd actually have to put your hand right here in between the eyes, actually, because the consensual light reflex tests if your opposite eye is responsive to the light being shown in one eye. If I put a hand here and shined light into this eye, I would pay attention to this eye here, to my left eye, to see if it constricts in response to my right eye getting exposed to light. And I would do the same on the opposite side. I shine light into my left eye and look to my right eye to see if the pupil constricts. It's not receiving light itself, but it is responding to the light that the left eye is receiving. And if both eyes constrict in response to the regular pupillary light reflex test and to the consensual light reflex test, then that can indicate that the optic nerve to the eyes are intact and not being affected by whatever's happening with the headache. I hope that made sense.
Next, I'm going to do examination of your eye, your inner eye, more up close. And this is called iridology. It's a study of iris of the eye. It is well known that your eye has a way to reflect, certain parts of your eye reflect the state of health of your body organs and your health overall. Even sclera lines can show patterns of your health up or down. So a few different things that we can look out for. So this is your eyes, right and left. I know it's a little bit scary looking, but it's knowledge, and knowledge is power. In a way, it's very similar to reflexology if you think about it. So your palms, your feet, your ears have a certain representation of an organ. So similar to that, you can look at the depth of your eye. You can look for spots, for discolorations, for darkenings, cloudiness, and so forth. And we can recognize what is dysfunctioning in your body. My tongue is rumbling. So here we're going to pay attention to the top part most of the time, as it correlates with your upper body, like your head. So we have position of ears here, left and right. Your eyes right here. Then we have some of your hormonal parts, your thyroid. Where is it? Right here. But I'm also going to be looking at this part, as it represents your nose, your sinuses. Also your spine right here, cervical, thoracic, lumbar. And I'll just look overall at the structure of your eye. Okay? So I'll put this down.
So what she just explained isn't actually called iridology. The correct term is iridology, the study of the iris and also the sclera. So the iris is the colored part of your eye and the sclera is the white part of your eye. And naturopathic doctors aren't actually trained in iridology. So even though this is a naturopath visit, in my own visits, I do not use iridology because I was never taught it in med school. If you want to know how to assess the body using iridology, you would have to go to a iridology school and enroll in their iridology program in order to do this kind of assessment. But from what I know about iridology, I think that she has given a pretty good summary of the study of the iris. Basically, different parts of the eye represents different parts of the body. So if you find a mark in a certain area of the eye, that mark may be a sign that something is off in the area that part of the eye represents. If there was a mark in the spine part of the eye, then there could be some dysfunction in your actual spine. So that's the general gist of what I know about iridology. There are some naturopathic doctors that do iridology, but again, that's only because they have gone on to some other program to learn it.
So if I may, I'll start with this side. Okay, and again a little flashlight, right?
So I don't know too much about iridology because again, it wasn't taught in naturopathic medical school. But from what I do know, at an actual iridology appointment, your eye wouldn't be assessed by someone just flashing a light in your eye and just looking at your eyes with their own eyes. Instead, they'd actually use a small camera and hold it right up to your eye to take a picture of your iris and your sclera. And then that picture would be sent to a computer, and the iridologist will actually look at the computer to see a very blown out picture of your iris and sclera to see the different markings and patterns of the iris and the sclera.
Very good. So far your eyes are great.
That's good.
And I'll make some notes, okay? Just 1 second.
So, a comment on her note taking. Whenever you go see a doctor, whether it be a naturopathic doctor, nurse practitioner, we all need to take notes about the appointment. We need to make notes about what the patient has said. We take notes on what we have observed on the patient, any signs and symptoms that they're experiencing. We also write down what we prescribe or what we do with the patient in the appointment. All those notes need to be taken down to put in their medical records. For me, I take notes on the computer because I type a lot faster than I write. And I'll take notes when people are telling me about their symptoms. I'll take notes on their medical history and stuff. And then when I do physical exams, I step away from the computer, I do the physical exams, and I try to remember the results. Or I'll try to remember what I see until the end of the appointment, where I go to my computer after they've left and try to type it all out before it falls out of my brain and gets lost in space. And other medical doctors do that too. Actually, a lot of medical doctors, you might not see them take notes after their appointment with you. They usually go to their office and they either type it out really fast, they type out their notes really fast, or they might speak into a voice recorder to comment on the visit, or they might use a dictation software where they speak into a mic and their words that they speak gets put onto a document on their computer. So that all happens after the appointment, not during the appointment. I think that if I were to do my note taking when the patient is with me, they'd grow really impatient and they'd probably get really frustrated that I'm wasting their time by taking notes in their appointments. I wouldn't ever do this and have my patient wait while I take notes.
You know, we're also here to diagnosis by your tongue and analysis overall of your tongue. Similar to the eye, as we just did, we can pay attention to the state of health of your tongue. It is very well known that the tongue has a lot of connections with our internal organs. Yes, I know, it's quite surprising, but it's actually very important to pay attention to your tongue. So you can notice here, we have a simple breakdown. So the back of your tongue often represents the state of health of your kidneys, bladder, and your intestines. For example, you might have noticed when you're sick, or if you had some kind of food poisoning, your color of the tongue will change, or you'll have this very strong coating on your tongue. That's a very good representation of what is going on in your body. Surprising, yes. Then the middle represents your spleen, your stomach. The sides talk about liver and gallbladder. upper part of your tip represents your lungs, and then the very tip is your heart. Okay, so I'm going to put this down.
So I like her explanation of examining the tongue. A lot of naturopathic doctors do look at the tongue. It's like another vital that a doctor takes. So the classic 4 vital signs that we usually assess are blood pressure, heart rate, breath rate, and temperature. But naturopathic doctors also look at the tongue to understand the overall health of a patient. For example, if the tongue has a darker color that's more purple and blue, that it kind of indicates that the patient has poor circulation. If the tongue is swollen and sore, that might indicate some nutrient deficiencies. Also, if the tongue is kind of red in color, like the body is really red, and if there is a thick yellow coating, that indicates some inflammation in the body. So the tongue can show a lot about a person's health, and oftentimes if you go to a naturopathic appointment, the practitioner may ask you to not brush your tongue before you come into their appointment, and they might tell you to not drink coffee or juice or tea because they want to see your tongue in its most natural state, even if it's gross looking. They just want to see what it looks like without any coffee stains or juice stains, and they also want to see what the coating of your tongue looks like before you brush it off when you brush your teeth.
And I'm going to use my little flashlight again. And if you don't mind, show me your tongue. Okay, open wide. Yeah. Okay, you look pretty good and healthy.
Oh, that's good.
Let's see. So I think I can easily conclude that the main concern we're dealing with is a muscle tension. You will be surprised, but more than 90% of all headaches are caused by a tension or a strain, which most of the time is caused by stress. So in your case, you don't have to worry about anything. Your organs are working great. You're doing so good. You're in a great state of health. The only thing we can work on is your mental state or your stress. I would strongly encourage you to relax more. Watch some ASMR videos or meditation videos. Get a massage, go to sauna, do some inhalations, maybe go for a swim or run. Okay? Take care of your mental health at this time. Stress is no joke. So I would really recommend you to do some stretches of your neck, like this, in circles, as well as some massages, one at a time. You would grab this muscle right here, squeeze it as tight as you can, and hold for about 5 seconds. Do the same on this side. And do some stretches of your shoulders as well, as often as you can.
Okay. So it looked like her final assessment for the headache is stress and muscle tension. Those are the causes of the headache. After all those exams, that is the conclusion that she has made. And I'll admit a majority of my patients who have chronic headaches usually have those chronic headaches because of stress, anxiety, and lots of muscle tension. So I treat my patients with a lot of acupuncture, meditation, relaxation techniques, cupping therapy, and gua sha to help them reduce muscle tension and also to help them relax and be less stressed so that they have fewer headaches. Now, for people who have headaches out of nowhere, it's an acute headache, so it's only been around for a very short time. I try to dig a little more into their health. I said earlier, headaches can be from various causes, and I definitely want to rule out the serious causes. And that might involve me getting some blood work. So I might send them to get some blood tests to see if their blood sugar is regulated and normal, to see if their thyroid hormones are within normal limits, because internal stuff can't really be detected or fully assessed by just looking at the eye or the tongue, or just looking at the overall, picture of a person. You need to do some internal tests, so blood tests and stuff like that. Like exams, like the vision exams are off, or if the person is slurring their words, or if there's some facial asymmetry, then I tell them to go to their family doctor so that they can get either an x-ray, a CAT scan, or MRI, whatever the family doctor recommends would be best, so that we can rule out conditions that we cannot see with our own eyes. You can't just make that statement that, oh, you're fully healthy, your organs are all fine, it's just due to stress, if you don't do some more due diligence and do the appropriate tests to really check that you're okay on the inside. But if all those tests come back normal, then I do talk about stress management and muscle tension, relaxation, and do all those therapies that I mentioned earlier.
I would also recommend you to invest in some essential oils, or I can give you these ones. Would you like some? This is a set for it's organic, highest quality essential oils. And you have 4 different ones, which you can use throughout the day. One is for keeping calm. One is for purifying wherever you are. One is to revive the senses. And one is for sleep. Okay? You can just pull them out.
Okay, big comment here. Naturopathic doctors have this reputation of using essential oils, and I understand where that reputation comes from in a bunch of comedy sketches and in the media, and now in this video, naturopathic doctors are often shown and depicted as just using essential oils for everything, and in reality, essential oils is a very, very, very small part of naturopathic medicine. I hardly use essential oils for anything. I only use essential oils for basically relaxation, for aromatherapy. And that's it. I want to touch on something that she said about the essential oils. So lavender is an essential oil that can relax people, and it can help people have a better night of sleep. But the thing that she said about purifying wherever you are and revive your senses, essential oils can't do that. They can't revive your senses, whatever that means. They can't purify wherever you are. Those are statements that are kind of fluffy, wishy-washy, and are a bit misleading. So if any doctor or practitioner says that an essential oil, or anything for that matter, purifies whatever or revives your senses, don't trust that doctor. Go see some other doctor instead, okay?
They're quite small sizes, but you don't need too much. You can mix it with water, especially the sleep oil. Mix it with water, just put a couple drops in the spray bottle. Shake it hard, spray around your room before you go to sleep. Isn't that wonderful scent? It has some grapefruit and lavender, and it's incredible. It's fresh, yet so soothing and so calming. Okay? So
I do want to make a comment about that. It's good that she informed her patient on how to use the essential oils, because that is really important to know about. When you do aromatherapy, it's really important that you dilute the essential oils by putting it in a spray bottle full of water and just a few drops of essential oil and spraying it, or using a few drops of essential oil in a diffuser with a lot of water. It's important to dilute it down so that it doesn't irritate your breathing. It's also important to use the essential oils in a well ventilated room. You don't want to use it in an enclosed room with all the doors and windows closed. Again, because if there's a high concentration of essential oils in the air, it can make you cough. It can make you have a difficult time breathing, especially if you have asthma. Also, high concentration of essential oils in the air can really affect the breathing of young children and infants. So definitely be wary of that. And it can also be a bit toxic to house pets like dogs and cats. Also, specifically for headaches, some people can be triggered by smells, and essential oils are very smelly. So it's not something that people should use for headaches, really, especially if their headaches are exacerbated with scent. So if that happens to you, definitely stay away from essential oils if you have a headache.
So another thing I would recommend is drinking some herbal supplement of valerian root. It is very good for sleep and just relaxing. Keeps your mind more at ease. Helps you feel more soothed and stress-free. Even the sound of it is pleasant. They come in small capsules that are quite easy to swallow. Sugar. I know they smell interesting, but it's just because it's natural. Okay. They're very easy to swallow. And inside is all the real ingredients to help you deal with your stress right now. Help you fall asleep naturally with it. Okay. So, I'll let you be.
Okay, so about the valerian root capsules, I love the sound of the pills rolling around in the container. So that's a really nice ASMR thing, and I like the sound of the capsules in your hand. But usually you'd never want to hold all those capsules in your hand and touch them because that just contaminates them all. Anyways, more specific on the valerian root, it is a very common recommendation that naturopathic doctors give. It's a root that is sedating. If you take the right therapeutic dose of the root, it can help calm you and make you a little bit sleepy. She made a comment on the smell of the capsules, and a lot of herbal remedies do have a weird earthy smell to it. Some have pleasant smells, but valerian specifically has a pretty crummy smell. If you smell valerian root tea, it kind of smells like dirty gym socks. So capsules are definitely better than the tea form of valerian root. Just a fun fact. Another fun fact is that valerian, while in most people it has a sedating effect, in a few people it has a paradoxical effect where if you take it, you might become more stimulated, actually. So if you have tried valerian root and if you find you're more stimulated after you take it, you might be part of that small population of people who react to it differently. But regardless, with whatever herbal supplement, you want to double check with your family doctor or with your naturopathic doctor to make sure that that supplement does not interact with your current prescription medications or harm you if you have a particular pre-existing condition or diagnosis.
You need to make a couple of mental notes. I know that she's stressed out, and I'm sorry. So I'm doing my best right now to help you in every possible way. Our world is full of very soothing items, soothing sounds, soothing people that help us deal with our stresses. So right now, I want you to relax and just be soothed and calm and soothed and calm. Everything is good. You're healthy and happy. You're loved. You're taken care of.
Okay, so that's pretty much the whole video. I had fun watching it. I really like all the sounds that she's presented in this video. I love her jacket because it makes a really nice sound. I like the sound of her gloves when she had them on, and her voice, again, is so soothing and relaxing. She is a really great ASMR artist, and I like these videos because there's a lot of really outstanding, very stimulating videos on YouTube, and it can wind people up. It can make people subconsciously anxious and stressed. So videos like these are really nice and relaxing. I wish I wore headphones to get the full ASMR tingling sensation, but I'll do it next time for some other video that she's made. Yeah, overall, this depiction of a naturopathic appointment is pretty good. She's done her research, and there are some inaccuracies, of course, and I mentioned them already, but overall, pretty good representation of a naturopathic appointment. I really like her warm, welcoming personality as well. I think that if she were to become a naturopathic doctor, she would be really great at it, because in our appointments, we try to do our best to make them relaxing and thorough, and she does exactly that. She's very relaxed and she's very thorough in her physical exams, which is exactly what you want from a doctor. And to have a relaxing, comfortable experience, that just makes the relationship between the doctor and patient a lot better, stronger, and more therapeutic. Anyhow, thank you so much for watching this video. If you think I should react to some other video on YouTube, please write it down in the comment section below. And as always, if you like my videos, please acupressure the like button or hit the subscribe button to stay tuned for my next video. Thanks again for watching. Take care and bye-bye.